Hello, and good evening to everyone. This is Dion Brown, licensed therapist here in the DMV and associate pastor. Welcome again. Welcome to all of our Facebook viewers as well as YouTube. Welcome to another episode of An Integrated Approach, where each and every month we discuss issues around the integration of mental health and spirituality. We're going to be talking tonight about a very important subject related to clergy, mental health, and self care. We want to thank everybody that's coming online. We're going to ask that you tune in, that you like, that you share with everyone as we go forward. Tonight, we're going to delve into these issues, but we want to mention to everyone public disclaimer that this show represents the opinions of the host, which is myself, and my guests, which I'll get into in a bit. And they should not necessarily be taken as medical advice, but you want to follow up with your medical professionals. We're going to share some things for informational purposes tonight. So, welcome everyone again to another episode of An Integrated Approach, where we integrate mental health and spirituality. And we're so glad and so grateful. We're going to bring him on in a bit. We're so grateful for our guest tonight, Bishop C. Guy Robinson. I'm going to share some things with you all who many of you know who he is. You're listening, you've been following, but we want to share some things with you about him. Bishop C. Guy Robinson is a bishop, pastor, educator, and a mental health theologian. He serves in the Full Baptist Church Fellowship International as Bishop of Mental Health Awareness and as a Maryland State Bishop. He also serves as the pastor of the Tabernacle of the Lord Church in Baltimore, Maryland. Dr. Robinson is also an adjunct faculty instructor in the School of Social Work at Morgan State University in Baltimore, Maryland, specializing in critical thinking, spirituality, and religion in the helping traditions. Dr. Robinson is also an adjunct faculty instructor at Hampton University in Hampton, Virginia, where he teaches courses in pastoral care in the Department of Religious Studies. He's earned a Bachelor of Arts degree in music, piano from Morgan State University, a Master of Divinity degree from Howard University, and a Doctor of Ministry degree in pastoral psychology and family counseling from Gordon Conwell Theological Seminary. He also studied pastoral.
I didn't get that. Could you try again?
Pastoral counseling at Loyola University in Maryland. Dr. Robinson has conducted extensive research and workshops in mental health theology, formation, biblical counseling, and paradigms for healthy partnerships between pastoral and mental health professionals. Dr. Robinson is the author of Critical Collaboration, Pastors and Mental Health Professionals as Partners in Care, and the co-host of Spirit in Mind, a weekly podcast featuring theological and mental health perspectives on current affairs. Dr. Robinson and his wife, Sandra, are the parents of 4 children and reside in Baltimore, Maryland. And without further ado, we're going to bring on Bishop C. Guy Robinson. Hello, sir.
Hello, sir. How are you today?
I am well. How are you?
Doing well. Greetings to everyone who's joining us today.
Thank you so much. Absolutely. I want to thank you for joining us concerning this very important subject as we talk about, clergy, mental health, and self-care. Want to thank you for, all of the information and expertise that you bring to such a viable topic. So want to again just welcome you and thank you for coming to join us and to share with us on an episode of An Integrated Approach. So, all righty. So, without further ado, we're gonna jump right into some dialogue and some discussions, and share concerning this vital and essential subject. All right. One of the things that come up when we talk about clergy, mental health, and self care is that historically in our churches, spirituality and therapy have sometimes been at polar opposites. In the day and age in which we live, however, it seems like there's a ever increasing importance for us integrating mental health and spirituality. And we're starting to notice some of those things and some of those trends occurring in our churches as well. Just wanted to open up for us to talk about, and I'll share some things too about the necessity of the partnership or the integration with mental health and spirituality, particularly in our churches. What are your thoughts on that, sir?
Oh, yes, yes. In a nutshell, I think it's so very important, particularly in the zeitgeist or the spirit of the times,
Mm.
which we are living today. It's almost as if it is beckoning us to collaborate, which literally means work together, to co-labor, and in a way, it is a reintegration, perhaps. There was a time, history shows, when there was an innately psychological component to theological disciplines. And the reasons for the separation over the years and the severance has many historical reasons. But I think we're kind of coming back to realizing that we're better together than we are separate.
Yeah, absolutely. And I am also noticing a trend as well in one individually in my practice with people who are coming in individually, as well as a number of churches and pastors are recognizing the importance of connecting and collaborating with mental health professionals. Many pastors and bishops will do a level of pastoral counseling and then refer out to maybe licensed Christian therapists for collaboration overall. So I do see that happening as well. Yeah.
Yeah. And in the true spirit of collaboration, the inverse is also applicable. I have talked to a number of um, of persons in the mental health arena who are recognizing the innately spiritual components of African American experience,
Mm,
and
awesome.
while not necessarily integrating that in a full-fledged theological way, but are at least aware um, of the fact that there is an innate spiritual component. And moreover, those interactions can be mutual, a mutual awareness that we need each other. That's a long way for not all, but some in the history of the psychological disciplines as well, that at one point had an aversion to matters of spirituality. So that co-laboring does have some mutual components towards reconciliation.
Absolutely, absolutely. Well, even when we look at pastors, bishops, prelates, organizations, and how they understand mental health issues. And I like what you mentioned too, just mental health professionals looking at the spiritual dynamic, even when they may treat a client or patient. But over the last 2 years, there's been a lot of mental health related challenges that have risen up as a result of this pandemic, as a result of COVID. Um, I'm sure you've seen as well as I have that as a result of all of the things that have come up referencing the pandemic and the depression and anxiety and anger, etc., it seems like a lot of spiritual leaders are and have been more so, definitely over the last 2 years, have been connecting their members and maybe even connecting themselves to practitioners. Have you seen the same thing?
Certainly an openness, and I certainly um, have supported that, and even advocated for that. That's really my position, in the Reformation in which I serve, or the fellowship in which I serve, is to raise awareness and advocate for this collaborative effort. Much to the idea of a pastor, as a pastor, there may be some other areas in which I don't necessarily do myself. I have a musical background, but I don't labor in choir rehearsals. I delegate that to someone who is proficient in that area, and helps to fulfill the vision in that way. Just like I may delegate and entrust others who do facilities work and administrative work. And so too is there room, I would suggest, in the kingdom to have persons who work in that area of applying intensive mental health and therapeutic, a ministry of therapeutic care, if you will, as a component of the larger vision of the ministry and of the pastor in the church.
I understand that. Okay, thank you for that. Considering, during this pandemic, many people in general have been dealing with a lot of grief, right? A lot of pain. It's been a lot of loss. And many men and women of God also have, I know individually, and when I did talks with groups, many men and women of God have lost friends, family, and church members during this pandemic, and it's been tough. It's been hurtful. I spoke for my bishop a few Sundays ago, and I spoke a word that had a lot to do with trauma, grief, and loss. And I told him, I said, before we even spiritually, before we even take our pain and our grief to Jesus, we need to grieve. We need to cry, let it out, to weep, because that's healthy for us. Do we think that pastors and church leaders who have lost friends, family, members, do you think that they are or will be getting their grief issues addressed?
Wow, that's a powerful question.
Yeah, it is. It is. Yes,
and a positive one.
Yes, it is, sir. Yes, it is.
Well, I'll start here. I am of the persuasion, and I like the way one counseling reference that I'm going to quote is, grief will not be denied. It's a matter of whether we consciously do it in a healthy way, or whether we act out unconsciously in less healthy ways. And so, is there grief? Absolutely. First of all, grief is a very human reaction. And it's even modeled for us in the scriptures when Jesus weeps, as the Bible says. Jesus wept. Moreover, the prophet said, when talking about the messianic hope, he said that he would not be comely, but he would be a man of sorrows.
Wow. Yep, absolutely.
Acquainted, familiar with, having the experience of grieving. And so that's a powerful statement for us to consider theologically as preachers, that if Jesus grieves,
absolutely,
then certainly we are not exempt from experiencing grief processes. It's a matter of being conscious so that we can make conscious efforts to process that grief in a healthy way. And sometimes that requires help from persons who are trained to do that. And grief, I'll end the question with this. I believe it's important to remember that grief is a reaction to loss, and loss comes in many forms. Not just existentially. So during this pandemic, for example, we've not only experienced the loss of life, that there's the biological loss of loved ones, but there's also the loss of ways of life.
Absolutely.
Worship services, for example, have been tremendously altered as we were learning ways to transition into online and virtual communities, many places, not all, but many. Learning, accepting some things that have changed. And whenever there's transformation, whenever there is transition in any form. That's why we cry at graduations and weddings. We're happy because we're coming into something, but we're also on some level aware that we're releasing something.
Yes,
and that we're never going back to that school or to that particular way. And so there's been many forms of loss in this pandemic, and subsequently many forms of grief or grief reactions or opportunities to grieve. So I think it's very key that we acknowledge that, as you said, and that we remain open to what some of these grief patterns might look like, so that we don't operate and misplace that grief.
Facts.
Taking it out on others, bully pulpit moments.
Certainly.
If you go with Elizabeth Kubler-Ross, its original premise, anger is a part of the grief cycle, and so it helps for us to be conscious so that we don't engage in misplaced grief. I'll close with this. I'm reminded of in 1 Samuel 30 when David and his men lost everything at Ziklag. That's certainly a loss, and they began to grieve. The Bible says they sorrowed until they had no more power to weep. And then the anger cycle kicked in, and they started speaking of stoning David. David certainly did not take their wives and children, but there's the misplaced grief that can happen when we don't have people, places, and things in place to facilitate that grief process in a healthy therapeutic manner.
Absolutely. Thank you for that. You're right. That was a complex question. and a lot to consider. One of the things that I'm seeing, some churches and ministries are now developing forms of grief support groups. So I think that can be very beneficial for people. But one of the things, like you said, people have lost more than just loved ones. They've lost their normalcy. Some people have lost that's and traditionally when people think about the term self-care, they may think about things like massages and trips and bubble baths, etc. While those things can be a form of self-care for people, we do also understand that there's a lot more to the concept of self-care. Twofold question for you with that. What
broke up a little bit, but what comes to mind when we speak of self-care? That's again such a great question. It is the conscious, intentional act for me of taking care of oneself to present the very best version of oneself as our ethical duty to self and to others. That means that, and you often, so it's distinguished because I also try to, as you alluded to in my bio, I kind of teach these courses in pastoral care to pastors. And one of the units that we cover quite extensively is pastoral self-care. And try to say that pastoral self-care is an ethical responsibility.
I like that.
It's a matter of stewardship, of me taking care of me as the gift of life that God has given, so that I present back to God the very best version and give him a return on his investment that we call glory, or giving God the glory, the return on his investment. So there's a spiritual responsibility to doing that. And then there's an ethical responsibility, because the basic premise is that I have to, if I'm ever going to be an instrument help and healing and growth in ministry in any way to anybody, I have to prioritize being the best version of myself. Yep. So it's self-care. It's not self-absorption. There is a distinction. A lot of people use that airline analogy, and the flight attendant saying that, self-care is that moment that you put that on in the event of an emergency, so that the second part of that is so that you can help somebody else. And that for me is the distinction between self-care and self-absorption. Would be, imagine that scenario where, the oxygen comes down and I just kind of take it all and suck all the air in the room with no consciousness of others who are struggling. That's self-absorption. But self-care is me taking care of myself with the conscious effort that once I'm the best version of myself, I will be able to help others and honor the Hippocratic oath of first doing no harm. So that's kind of just a quick response to why self-care is important to us in ministry.
Absolutely.
Yeah.
And I like really what you said. It's such an intentional, deliberate focus on taking care of ourselves. But I like the notion of it being, kind of an ethical responsibility. And one of the things that I share with people a lot is that you have to take care of you, taking care of you first, particularly caregivers, that you become enhanced in your ability to care for others. Now, clergy, people, men and women of God who are called to the ministry, who are called to the work of ministry and have this call and have this burden. Do you think that in your corresponding with other pastors and bishops and even teaching your courses, do you think that some clergy struggle with the notion perhaps that self-care for them or engaging in self-care for them is selfish?
Short answer is yes. I would say, do I run into sometimes those perspectives, sometimes subconscious narratives that kind of form in us. So yes, there are some that kind of sometimes think that, and then so how do you balance that sometimes think of self-care as selfish? Yes. And that's part of the responsibility of those who do things like yourself and my goals as a teacher is to kind of make that point that self-care is not selfish, is actually a matter of stewardship that makes us stewardship of our own bodies, spirit, soul, and body. As 1 Thessalonians 5:23 says, your whole spirit, soul, and body be preserved, is what the text says. So may you could do ministry in a way that preserves your spirit, soul, and body so that you can be the best example for yourself and for others. That sometimes has to be reiterated, and sometimes they are unconscious, quite frankly, narratives that influence that behavior. We do have, and there is a hermeneutic of enduring suffering in our theological praxis, in our narratives. And so sometimes that can turn into a warped version of that thinks in the only way to be effective is to suffer as in the name of self-neglect, that somehow there's glory in self-neglect. And so sometimes you do have to kind of help to kind of balance that so that it is regulated a little more, way that encourages health. One of the ways, I'll close with that, because perhaps a good example that I often use is Numbers 20, when Moses is in Kadesh. And in Numbers 20, it's an interesting theological narrative with some self-care things in it that raises questions. it is the place where Numbers 20 says, and Miriam died there and was buried there, right there in Kadesh. And it says that as a sentence. But what becomes significant to that is that a few verses later, they run out of water. A few verses later, Moses prays, and God tells him to speak to the rock. Moses comes out and hears the people, and they push his buttons. And instead of speaking to the rock, he strikes the rock.
He does. Oh.
And it begs the question that is there any connection between the passing of really Miriam, very close to you. We don't know that, but if Moses were in a therapy session, it might be a point where that someone like you might say, I'm wondering if you took time to take care of yourself in light of the passing of your sister, and if that perhaps influenced your ability to hear God clearly.
Exactly.
And if it perhaps made you a little more short-tempered than you would have been if you were a stronger, healthier version of yourself. The text doesn't say that, but they're good lines of questioning if we were doing some motivational interviewing.
Very good. Very good line of questioning for sure. Very good. And that sounds about right as far as the type of question that I would ask. So with self-care being a ethical responsibility and important, unfortunately we see sometimes manifestations of maybe sometimes pastors and evangelists, prophets, bishops, etc. Manifestations come forward, kind of different things that happen, and some of that could be contributed to potential, lack of self-care, especially when burnout occurs. And burnout can occur in ministry. What do you being I'm just a lowly associate pastor. You're, as a bishop for you, as a bishop and a pastor of a church, and your position in the fellowship, what do you see as some hazards for people who are in ministry who neglect their self-care?
There's like any occupation, like many occupations in the caring professions, there are occupational hazards. Some of them can include compassion fatigue, as some call it, caring too much, if you will, meaning beyond the boundaries of our own health and wellness. And so we are certainly susceptible to that. We're susceptible perhaps to some messianic complexes where we want to be everybody's savior. In the absence of boundaries that say, I would, but I can't. Not exercising the need to sometimes refer to say, hey, I hear you, and I believe you could be well served if you do this. So I think that all of those stressors and some of the ones we just mentioned in that text, it affects our ability to hear God. It affects, actually, there's some research out that even says in the pandemic, 49% of pastors and ministry workers and leaders have self-reported difficulty in maintaining their spiritual disciplines, which is a form of self-care as well. As you alluded to earlier, we often think of self-care and images of beaches and picnics come to mind, which can certainly be a part of that. But there are branches and many areas of self-care: physical self-care, spiritual self-care, financial self-care. And so all those require us to kind of be in a place to hear God clearly and even to look within and to introspect. And it takes a lot of effort for some of us to really spend those moments looking within and being introspective and being meditative. Those disciplines are so important, but they're not easy to do for those of us in the helping professions.
Interesting. Okay. Yes, I agree with you 100%. Those disciplines are vitally important. Particularly for men and women of God, wherever they are, whatever level they operate on. I have some thoughts about it. Why might those disciplines be, and those disciplines are vital, essential part of one's self-care. Definitely, spiritual self-care, maybe some other aspects. What might make those disciplines difficult?
If this were, I'm just going to do word association, quick answers.
Sure.
In short, a conflict of wills.
Okay, that's good.
There's certain things we want, certain things that we have expectations for, and sometimes life and or purpose doesn't meet those expectations. And whenever there's a disconnect, in my view, whenever there's a disconnect between expectations and experience, pain is the barometer for that. And the intensity of the pain is commensurate with the distance between what I expected and what were my experiences. Looking within puts us in a very vulnerable position um, to examine ourselves and perhaps even consider or have someone to walk us through that as a therapist, to ask internal questions that cause us to look at ourselves, maybe even dismantle false selves.
Yep.
That's the work, I would say, of self-care. That isn't easy, but is very fruitful if we have the courage to look in that mirror, if you will. But that also may mean that we have to give up some images, and we have to give up some false images. We may even have to give up. The scripture puts it this way: there are many other plans in a man's heart, but it was the Lord's purpose that shall prevail. And so, as we begin to look at certain expectations and then bring them in line, I think that's the challenge. It's the Gethsemane moment when Jesus is like, in his humanity, let this be this way, but then nevertheless. But to get from that point to the nevertheless is really a lot of work. Sweat falling, as the inspired writer says, from his brow like drops of blood. It reveals the intensity of that, if you will, battle of the wills.
Absolutely.
And so I think it takes courage to look within and be willing to adjust our expectations accordingly to what we find in the mirror.
Okay. Thank you. I appreciate that very much. So I created a Facebook post one day just to kind of throw it out there. I tend to do a lot of work in my practice. I'm working on some materials, I'll say that for now, as it pertains to self-care. And I asked the Facebook audience, are there any particular top reasons that they may think that it's difficult for clergy to invest in their own self-care and take time for their mental health concerns? And it was a pretty thorough list of reactions and responses. If not to put you on the spot, but if you had to itemize down to 3 top reasons that make it difficult sometimes for clergy to invest in their own self-care, what would those 3 top reasons probably be?
Great question. There's actually some research done that has been done on that subject. The number one, where's the Family Feud survey says, number one survey response to that question is and I repeat them because I relate to, I would echo the same. Number one is trust. It's trust issues, meaning a trusted source.
Uh,
Um, um, where do caregivers go for care in confidentiality?
yep.
Um, um, and so that's number one. I'll give that just to answer your question. Number two is discomfort with the role reversal.
I like that. Yeah.
Um, uh, um, being used to being the one who hears presenting issues and not presenting issues.
Mhm.
We're more used to hearing presenting issues than we are presenting our issues, which kind of creates an encyclical back and forth with like, and if I were going to present the issues and sit on the other side of the desk,
Mhm.
or to whom would that be that I can trust? Um, and then number three is anxiety about the consequences.
Mm.
Um, what would really treating this issue look like and entail, and how might that affect what I do, and even who I think I am? So that's a kind of anxiety as well.
So those three top reasons for that clergy might have difficulty investing in their own self-care. You said trust issues, discomfort with the role reversal, and
Repercussions.
yeah. Oh, discomfort with the repercussions.
Right.
Okay. Yeah, interesting. And anxiety.
Repercussions. I'm sorry. Like, anticipatory, like anxiety. What
Yeah.
what will happen if this gets out?
Yeah, that's big. That's big, which is understandable. Definitely. Okay, that makes sense. That makes a lot of sense. Um, and those can be pretty strong barriers, unfortunately, I know, for clergy. I think the trust issue is pretty big, especially depending upon the situation and the person and who they are and how visible they are and their connectedness. That can all of those factors that you mentioned, can be a barrier. That for some would be essential to sort out, which probably is not an easy process to sort out how to swim through some of that.
Yeah, and history. Before, just like in any profession, really, but since we're specifically talking about clergy and mental health, before being clergy, we were people, and we bring histories, we bring attachment styles, we bring attachment issues, we bring childhood traumas, all of which, and we bring feelings of betrayal.
Yep.
And so we bring all of that in our history, even as we are now operating in ministry. And so some of the trust issues may have started, a long time ago. And so in various forms of abuse, be they with physical abuse, be they with family backgrounds. And so we bring that, and the Lord ministers to us as pastors, and calls us and uses us in spite of us, but still there are these areas of untreated trauma that have trust that are triggered by some things in the everyday work of ministry. So that's why that piece of having that self-care that we're talking about, and even having someone to whom we can talk transparently, is so very important.
Absolutely. And sometimes people, men and women of God, because the call to ministry is a serious one. It can be very levels of intensity. involves a great deal of hard work, labor, submission, sacrifice, faithfulness. Um, I have discovered that many people struggle, maybe kind of connected to some of the processing mentally of what we talked about, self-care being selfish for some of them and their thoughts, as well as this, I have this faulty theology, I have to, suffer, etc. But downtime, trips, travel, vacation, trips, travel, vacations, disconnection from, or like I said to one group, work or ministry free vacations, work and ministry free vacations. Is this something that should probably be implemented into a person's regular schedule if they're constantly on the go, serving, teaching, preaching, counseling, weddings, homegoing, and the administrative task and finances and the large pool of tasks, particularly assigned to senior pastors? Should work and ministry free vacations be, as far as a form of self-care and a form of pausing, should that be probably, and I've talked with a lot of clergy who struggle with this, should that be probably, a lot of people have, I'll get around to it, I'll do it next year, or maybe if I have time. What are your thoughts about that being probably integrated into the regular flow of things?
I think it should be. I think it's that point of recreation, recreation. I think it is so very important. I think, and I talked to and on campus teach a lot of persons who subscribe to that and give intellectual assent to that, but struggle to actually recognize the moments to practice it, or as you said, put it off for a while, and then it never happens. And so, and I think we do ourselves and others a disservice when we don't do that. But I think it's easier to give intellectual assent to, and that's why sometimes we may need some help. That's why Jethro pulled, Moses had Jethro said, listen, what you're doing is not wise. And what he said is pivotal. You're going to wear yourself out. And so we need those accountability partners to whom we can talk and to who can talk to us like that as well.
Dude. Well, Bishop, we got a question here. Let me see if I get, there we go. Dr. Paradise Watson. He's I think psychologist as well. Who's in ministry? What do clergy need from mental health professionals who are clergy to positively influence the ministry, pastors, the body of Christ, to care for mental health as we do physical health?
Dr. Watson, you have asked a powerful question. When you get the complete answer, or when Elder Brown, Counselor Brown gets it, whichever one of us gets it, please share it with all of us. I say that with some comedic response, but quite frankly, the serious thing is, I think that's a work in progress. I think we're on the right path in terms of teaching. I think this is such a critical season for the consistency of teaching and making those points known. So I would say presentations like this one that Elder Brown does, I think it's the season. I think the circumstances and time and opportunity are orchestrating themselves. And if we can point out moments like that to say this is a mental health crisis, to make it a little, but we have to be persistent in that. We are overcoming um, um, really decades upon decades of severance between those two things. And we're battling, quite frankly, I'll end with that. We're battling some social realities. And by that I mean, in a complex society, we have learned to compartmentalize for the cause of specialized labor. That's how you make a large society work. This is the agricultural industry. This is the military. This is construction. And we've done that with our anthropology as well. This is the physical self. This is the mental self. This is the spiritual self. And we study, and that certainly works well for us. Compartmentalizing works well for us academically because we learn by compartmentalizing and working. It works well for us professionally because your body, you work on the body, you work on this, and it's very compartmental. However, it can be argued that anthropologically, those separate compartments on a day-to-day function work more interdependently than our studies. So what happens to the body can influence the mind, and the psychosomatic realities are part of that integrated thing. And so I think that it's going to become necessary for us to study individually, have some areas, almost like a Venn diagram, not to take us back to math class, but in a Venn diagram, there's certain areas there are certain distinctions and specialties, but there are certain areas where those circles overlap. And I think we have to point out where matters of spirit, soul, and body overlap so that we can integrate them into ministry and even into day-to-day conversations in a more effective way. And in the flip, to sometimes introduce when those moments are out there, that's what we do. That sometimes what seems like a societal problem does have a spiritual component because they overlap. And sometimes social ills become a moment for ministerial opportunities because they really are more integrated in function than they are in our disciplines for the cause of study and for the cause of division of labor.
Thank you for that. Thank you for that. I believe you answered Dr. Watson's question thoroughly. Thank you very much for that detailed response, sir. That was awesome. All right. So when we talk about self care, and we talk about self care and clergy, um, body, soul, and spirit, and everything connecting and interacting with each other. Do we find clergy, just some clergy rather, failing in general, perhaps, to take care of their overall health, whether that's um, physical, pertaining to their nutrition, fitness, hydration, and sleep, as well as mental health? Do we find a sector of clergy in general just kind of failing in reference to their, for whatever reason, just kind of failing in reference to taking care of their self care?
Um, in a word, yes.
Yeah.
Yes. Again, it's an occupational hazard because a key word, which is one of the reasons why I do subscribe to the idea of having an accountability circle and relationships, be they a combination of therapeutic and pastoral. Pastors can benefit from having pastors. The reason for that is because of this need to constantly keep these things in balance. How do I care without caring too much?
Yeah.
And how do I, and at what point have I overextended myself? And at what point am I, out off the chart, doing all this over here? And what does balance look like? And we need that in terms of accountability relationships, because as you know, we don't usually see our own pathology as easily. uh, or as Jesus put it, it's easier to see a splinter in someone else than it is to see a beam. That is biblical language for saying we don't see our own issues as well.
Facts. Very true.
That's why it's so key.
Yeah, absolutely. Thank you. Yeah, we don't, and it's vitally important. One of the being both clergy and clinician for myself, one of the things that I just recently am looking at adding to the types of services that my practice offers, as I've heard this come up, and they already do it in some circles. They already do this in some circles, but like we said, the call to ministry is a tremendous one, and everything that it involves and it takes. And so for my master's program, it was required that we have about 30 sessions of personal therapy done on us to make sure we were mentally and emotionally sound. I know that they do this in some reformations right now. What are your thoughts about as far as self-care, making sure that particularly new clergy are well and taking care of themselves well? What are your thoughts about new clergy at least, either being required to have psychological evaluations or engage in a set number of therapy sessions to assess ministry readiness?
I tell you what, I'm going to. I'll give a story.
Works.
Be transparent. Now I'll have a moment of self-disclosure.
All right, sure.
I think that it can be a life-changing experience, and I say it as part of my own testimony, which people know, which is why I serve in the position that I do in the fellowship. Again, the Bible says, many are the plans in a man's heart. It's the Lord's purpose that will prevail. It was my full intention. If you had asked me 13 years ago, maybe 15, I've been pastoring for 13 years. So if you had asked me 13 years ago what I was going to be doing, all roads were leading to me totally putting the proverbial shingle out. So I'm totally relating. And in my clinical supervision hours accumulation process,
sure,
I got a call to come and pastor a wonderful church.
Wow.
And found myself at a crossroads. And the Lord made it clear that I was to integrate that. I say that only to say that as a part of that, I am very familiar with the 30 hours of therapy that are required. And it was in those sessions that transformation beyond explanation began to happen for me. Self-insight, everything from multiphasic personality inventory tests to Myers-Briggs to Enneagrams, everything. But what it did was open the eyes of my understanding to how people work. And I think that in ministry, we are fundamentally in the people business. And we have the responsibility to, first of all, be the healthiest people we can be.
Facts.
And so I certainly believe and I recommend it. I think that what you're proposing is certainly innovative, perhaps provocative, to use that word again.
Very.
But is ultimately so helpful, first of all, to the minister. And then subsequently to those that we serve.
Absolutely. Sure. Definitely. And again, I know that I've had clients in certain denominational pathways, I'll say that, but that was a part of their training where it was mandated that they had to get a clear psychological evaluation for ministry readiness to make sure. Had a few clients of mine tell me that the fellowship they were connected to, or the network of the type of churches they were a part of, that was a part of it. So I was like, oh, interesting. Okay. Definitely different in some of our maybe branches, but it probably will be overall beneficial. So I am looking at that for my practice throughout the DMV as well. So we are coming down to the final wire of our great discussion about clergy, mental health, and self-care. I think between both of us, we could probably talk about this all night. But what before we close out tonight with our listening audience, if people are viewing on Facebook and YouTube, and this will be stored on my YouTube page permanently under DMV Therapist, and it's on my Facebook page, so people can come back and look at it and share it. But one of the things that I share a lot with people is the importance of creating like a self-care toolbox. And I have my own type of toolbox that I use for myself, tapping into my own self-care. But any final thoughts concerning clergy? And both of us are acutely aware of the benefit of therapy as one type of great tool for self-care. Any final comments or thoughts concerning clergy that are on now or will be listening, that about how therapy may be a viable tool to benefit them in their wellness?
Just that I've come to think of it as a part of our ministerial preparation.
Love it.
Much like if we know we have a preaching assignment, then there's certain things we do to prepare for that. We study, we pray, we kind of maybe get a feel for what's going on in the news. I believe it was Karl Barth that said every theologian ought to have a Bible in one hand and a newspaper in the other.
Love it.
So
very true.
So there are things we do to prepare. Dr. Charles Adams said great sermons are birthed in the prayer closet and matured in the library. And so there are certainly things that we can do to prepare. And I would say that as a part of the holistic preparation that's where self-care comes in. Again, it's for ourselves as an act of stewardship, but it's also for others as an act of preparation, so that we, by the grace of God, present the best version of ourselves to minister to people to the best of our ability as vessels of God. And so I think that's a part. I think that's a regular and necessary and important part. So I would just encourage persons to do it.
Okay, absolutely. All right. So we want to thank you all for coming and listening and tuning in for another episode of An Integrated Approach, where each and every month we have some invited guests come in and talk about issues related to mental health and spirituality. Bishop Robinson, we thank you so much for spending your Monday evening time, or at least an hour of your time tonight with us, sharing and talking and discussing information. And the sharing information has been tremendous. We want to thank you. You got a comment? Let's see what happens. Let's see what. Someone said great teaching. Thank you all. Okay, good. So it's been a pleasure. I am going to share for our listening audience, if you wanted to connect with Bishop Robinson or reach out to him, I'm going to share his information for you all. Facebook information, IG, his Twitter, as well as his office number. Bishop Robinson, you also released a book. Did you want to mention that to people listening?
Oh, that's kind. Certainly. My book is entitled Critical Collaborations, right there.
Absolutely.
And mental health professionals as partners in care. And so it's available on Amazon. It's available in electronic form, as well as the actual physical book. And so thank you so much for your support. We're working on a follow-up to that, actually, even now as we speak. And so keep us in prayer. But critical collaboration, C. Guy Robinson. Thank you.
All right. And I have your book at home too as well. So thank you for the valuable insights that you provided in that book. So I'm going to ask Bishop Robinson if you would hang out for a minute. I'm going to officially end, but I want to thank you all for coming again and for tuning in, for listening, for sharing. You will be able to watch the replay again if you missed any part of this great discussion and dialogue on clergy, mental health, and self-care on my YouTube page at DMV Therapist, as well as it's on my Facebook page under Dion Brown. And until next time, next episode of An Integrated Approach, thank you all and have a wonderful night.